Imagine trying to communicate, but the words just don't come out right, or listening to someone and each word feels like a puzzle with missing pieces. For a lot of children, this is their daily experience. Today, we are going to talk about a topic called DLD, Developmental Language Disorder. In DLD, children struggle to understand or express language. I will try my best to break down complex things into more simplified words so it's easier for you. But if you find any word to be difficult, please comment below and I'll be more than happy to reply back to you and clarify it. Before I move on to the symptoms of DLD, let's talk about prevalence of DLD, how common it is. So DLD affects about 7% of children. So it's more common than autism and ADHD. Which brings us to the second thing. Despite its frequency, it is still underdiagnosed. It's more underdiagnosed than ADHD and autism because a lot of people are not aware of it and also mistake the symptoms for something else. Let's break down the key features that define DLD, that is Developmental Language Disorder. Number one is persistent language difficulties, which can be divided into two parts, receptive and expressive. Receptive is when the children, they struggle to understand what is being said to them. There is no problem with hearing, it's more about processing what's been said to them. They find it quite difficult to comprehend the words, the sentences, or the phrases or the instructions that have been said to them. Number two is expressive, when the children are not able to express, not able to say the right words. They might find it hard to express their thoughts and ideas. Sentences may be short, simple, or grammatically incorrect. Number two is specific language components affected. Let's explore this in detail. Number one is phonological awareness. This refers to ability to recognize and work with the sound in spoken language. For example, noticing that cat and bat rhyme and words such as sandwich can be divided into sand and witch. The second component of specific language components affected is syntax and morphology, which is also known as grammar. Syntax is the set of rules that dictate how words are arranged to make sentences. Morphology involves understanding the structure of words, including prefixes and suffixes. Children with DLD may have trouble forming sentences in the correct order or using proper word endings. For example, they might say, "He goes door," instead of saying "he goes to the store." The third component is semantics. This is about the meaning of words and sentences. Children may have a limited vocabulary or misuse words because they don't fully understand their meaning. The fourth component is narrative skills. The ability to tell stories or describe events in a logical sequence. A child with DLD might tell a story that's disorganized or hard to follow. And the last component is pragmatics. This refers to using language appropriately in social situations. People with DLD might find it difficult to understand jokes. They might struggle to take turns and they might just interrupt as well sometimes, and they might not know when to change language or when to change the tone in a social situation. They struggle to understand different social cues and might say something which is out of context. The third key feature is language abilities which are below expected age. Children with DLD would struggle with language and their abilities would be below the expected age. And if this is not addressed early, this becomes a huge problem for them throughout their school life and then beyond that. Number four is early onset. Because it's a developmental disorder, one can appreciate that the kid who has DLD might be struggling with language as they're growing up. Number five is impact on daily life. Children with DLD, their communication is impacted. So that's why they find it hard to make friends. They find it hard to participate in social activities, in different kinds of games, because they know that they might struggle in communicating or expressing things back to their peers, or even sometimes understanding the instructions in a game. Also to remember that DLD is diagnosed if the language is not being affected by autism, hearing problem, or any other organic cause, for example, brain infection or anything else going on. Now that we have discussed the key features of DLD, let's move on to other features of DLD. Number one is variable language skills. Just imagine language skills are like a toolkit. Now, children with DLD might not have all the tools. So for some children, they might be able to be more receptive. That means they would be able to understand more if you tell them or if you give them any instructions, but they might not be able to express it properly. And it can be vice versa as well. So it can be either way, or a child might have both of them, that is expressive and receptive issues. Why it matters is that knowing which tools are missing from the toolkit will help the therapist and the parents to tailor the right kind of support the child needs. Number 2 is co-occurring conditions. DLD doesn't always come alone. It can be associated with other conditions such as ADHD, dyslexia, pronunciation or sound speech disorder, which I will be talking about in my next videos. So they can co-occur. Understanding these overlapping conditions is very crucial to have the best therapy or to tailor the best support for the child. Now let's talk about normal language development versus DLD. Language development varies from child to child, but not every delay is a red flag. So let's explore what a normal language development looks like in comparison to DLD. Some children might start talking a bit later on, but then catch up naturally. These development can be within the normal range. Let's talk about it. By the age of 2, concerns arise if the child is not using simple words such as mama or papa. By the age of 3, a lack of 2-word phrases, for example, more juice, can be a sign of DLD as well. If the language difficulty persists beyond the age of 4, it can then indicate towards something or some delay which is not natural and will indicate towards speech developmental disorders and would need checking. We should also consider cultural and bilingual differences in homes. Children raised in bilingual or diverse cultures would show different pattern of language development. However, a genuine language disorder will impact across all settings. Now let's compare DLD with other conditions. Differences from intellectual disability. DLD specifically affects language skills and doesn't imply broader cognitive challenges. So unlike intellectual disabilities that impact all areas of thinking and daily functioning. Differences from speech sound disorders, which I will be talking about in my next video. While speech sound disorder involves pronunciation issues, DLD primarily affects how language is understood and used more broadly. And by the way, both of them can also exist together. Difference from speech fluency disorder, that is stuttering. Stuttering is characterized by interruptions in flow of speech, such as repeating sounds or words, which is indistinct from the type of language understanding and use issues seen in DLD. Differences from autism spectrum disorder. ASD includes broader issues with social communication and repetitive behaviors, whereas DLD is mainly concerned with language processing and production. So in ASD, you'll be seeing other patterns, other behavioral patterns, which is not seen in DLD. Number 5 is selective mutism. Children with selective mutism usually choose not to speak in certain social settings despite being capable of speaking normally. In my clinical experience, I've seen selective mutism to be more present in school. So the child would actually just not speak in school at all, and once they come back from the school, they will start talking. This is called selective mutism in children. It is different from DLD. So children with selective mutism, like I said, usually choose not to speak in certain social settings. Number 6, difference from hearing loss. Hearing loss directly affects the ability to hear sounds, leading to language delay, whereas DLD involves deeper processing issues unrelated to sound perception. As we have discussed today, that DLD is more than just a speech delay. It needs a lot of support, a tailored support and therapy, which varies from one child to another. By giving them the right support, we make sure that the child performs with their full potential and can excel in their school life and then after that as well. So stay tuned. In the coming weeks, I'll be making videos about different treatment strategies that we use in DLD. So if you like the video, please don't forget to like, share and subscribe. Thank you for watching.